Welcome to our community forum. I'm John McCall, the Chief Executive Officer of DeVille Family and Youth Services. Today is our special guest, Dr. Nancy Martinez, Child and Adolescent Psychiatrist for DeVille Family and Youth Services. Welcome, Dr. Martinez.
Hi, good morning. Thank you for having me.
Yes. Can you begin by telling us a little bit about your background and your training as a child and adolescent psychiatrist?
Sure. So I'll start with my background. I am a SoCal native. I'm actually first-generation American. My parents both immigrated from their native country of Mexico. Funny enough, I actually decided I wanted to be a doctor back when I was like 7 years old. Wow. At that time, I really only, based it on the fact that I really like science and I admired doctors. Then as I grew older, my passion and interest for the human organism, understanding the human organism and health, that grew and developed and really inspired me to continue pursuing a career in medicine. With more experience and time volunteering in healthcare, I really began to see the need for representation of Hispanic and the Latino community within medicine. And so that was more of my inspiration as I got older. The American population, the Hispanic population within America is actually about 18%, but amongst physicians, only 5%.
Wow.
Yeah, a little over 5% are Hispanic or Latinos. And female physicians are even less. There's only about 2% of Latina physicians. So that was definitely one of the things that I thought became very important in my career, really focusing on representation of Latinos in medicine. So that's a little bit about my background.
Okay. How has it been for you as a doctor, basically being Hispanic and being Hispanic female? How has that been?
I have to say overall, I think even though I decided so young that this has been a great experience, I love my profession. I love the art of medicine. Child and adolescent psychiatry is, such a huge field in terms of the need, but there's very few of us, again, very few practicing child and adolescent psychiatrists, so the demand is greater than the number of doctors practicing. And so what it means to be a child psychiatrist is basically that makes us specialized physicians, right? We're just like any other doctors that trained in medicine, so your family medicine, your pediatricians, surgeons. But then after medical school, we go on to do a psychiatry residency, and that's usually a general psychiatry residency. And from there, we go on to do a child and adolescent fellowship. So a lot of years of training, but critical, right? All of that training is so important to do the good work that we do. So as a psychiatrist, I get to work with a multidisciplinary team, right? Typically, that can involve social workers, psychologists, therapists. For kids, that can also involve teachers and school staff. Sometimes we work with parent partners, and you can talk a little bit about that as well. Okay. How at DeVille we have such a comprehensive group of people that work together in terms of the treatment team.
Okay. Historically, African Americans and Hispanics have been reluctant to access mental health services, and particularly psychiatric services. Can you speak to that?
Sure, yeah. I think that is definitely an unfortunate truth where we know that there, for cultural reasons, like you mentioned, Black and Hispanic communities have been more reluctant to seek out medical care, and especially psychiatric care. I think that's something that needs to be addressed on a public scale, and I think that things like this where we're increasing awareness in the general population and really decreasing the stigma of mental illness, right? So that people know what to look out for, and then know that there are services available.
Okay. In the age of COVID, with all the fear and the anxiety about contracting the virus and potentially dying, and its impact in the minority community, can you speak to that fear and concern?
Sure. I think when COVID first started, when we first started hearing about it, and then when it got here to California, there was a lot of fear, right? Because some of that just came from the uncertainty. We didn't really know what we were dealing with, right? It was a new illness from the novel coronavirus, and so the unknown always generates this sense of uncertainty and fear and anxiety. And then on top of that, there was so many sudden changes. Businesses had to shut down very quickly. Schools shut down very quickly. Nobody knew exactly what was the right way to handle it, but we've, as a community, it was decided that social isolation was definitely the place to start, right? Social distancing, and so I think for people that was very frightening, right? We didn't know how long it was going to last. We're still in it now. We didn't know how businesses were going to be affected, and for families, especially minority communities, you had a lot of people that are traditionally working in positions that are considered essential workers. So now, you're hearing, imagine that, right? You're hearing, oh, this is so dangerous, this is so scary, you have to stay home, but your employer is telling you, well, no, we need you to come work, right? Okay. And so that's scary. You don't know if they're going to be taking all the precautions, and the information in terms of transmission was still limited. So the fear of having to go to work, potentially bringing home illness, that's another thing to worry about. And then in minority communities, we also see that we tend to have like multi-generational families living together, and so this was another threat that was not present in their lives, having to work and then maybe having grandparents at home, or young children at home. So a lot of different things that really could have reasonably caused fear and anxiety. I think with time and information, that's relaxed a little bit, but even so, we still have a lot of unknown, and in terms of like the long-term consequences of COVID. And then we know that the Black community and Latino community were hit harder in terms of people actually getting sick, being hospitalized, and then deaths. So a lot of things going on that can really heighten the anxiety even more within these communities.
Okay. Primary consumers that the Ville serves reside in socially and economically marginalized communities. In your practice, have you seen the difference between consumers residing in that environment versus other of maybe higher socioeconomic status?
So socioeconomic status is particularly important because of the external factors that become an issue in things like health, right? And that's true of mental health, but also physical health, right? We see medical problems that are more common in specific ethnic backgrounds, and it's not always because of the ethnicity, but more so because of the environment. And we know that a lower socioeconomic background also puts you at higher risk for exposure to domestic violence, exposure to community violence, and these are things that can have varying degrees of effect on your well-being. Again, in terms of the prevalence of the disorders, that's relatively equal. But then we see something like autism, right? It's estimated that 1 in about 54 kids has autism. And that's true for white, black, and Hispanics. But what we see is that people of higher socioeconomic background or whites are more likely to be screened and to have intervention earlier, which means a better prognosis. And of those 3 groups, Hispanics are the least likely to be screened early on.
Wow. Well, I'm curious. This notion, that particularly in the African American community, when you talk about mental health, the C word comes up. The C word being, are you saying my child's crazy? And in a lot of homes, it's whatever goes on in this house stays in this house. So what do you think some things can be done to help break down that stigma, that barrier, that because you have a problem doesn't mean you're crazy?
Yes. Yes, definitely that word. I mean, it's such a hurtful perspective, right? And it generates this feeling that nobody likes, which is shame.
Yes.
Right. And that's why we feel the need to hide it, right? And that's why families, they don't talk about it. They don't get help, or so that's something that is detrimental for generations, right? It doesn't affect just that family member, and that's one of the reasons why it continues to be the case, right? Maybe your parents grew up that way, and their parents grew up that way. I think it just starts with talking about it, right? When people don't know, things are much more frightening. So we just have to continue to do the work about talking of all the different disorders and illness, and really just increasing that awareness. The more you hear about it, the more you can recognize things, and then you can actually put other words to it, right? And not have to use the C word, because that's such a hurtful way to describe a person's situation, and especially in the fact where they're experiencing true health issues and true mental illness. And I really do think that LA County Department of Mental Health and organizations like DeVille are doing a lot of work in this, and it starts with things like this, right? Outreach, talking about what is out there, and then talking about reaching out, right? I think it's a terrible situation for people to feel this pressure to suffer alone, when really there's so many options in terms of treatment. And I think there's also this fear of being labeled with something. Nobody's going to label you with the word crazy, right? But being labeled and being judged. And then also, there's this fear that you only go get treatment when things are absolutely terrible. You have to be at this, in this horrible position, unsafe, very unwell. But that's not true, right? We see that in lower socioeconomic status because they have less access. We see that in Latinos and Blacks because they don't have the information, or have less access. But really, that just complicates the picture, right? That means that the longer you take, the more problems there may be, and the harder it is to get better.
Okay. DeVille has a large presence on school-based campuses. And we're well integrated into many of those school sites, but now school's closed.
Yes.
What do you see as the impact of that on children who need help?
Yeah, so, I think that's a great program, by the way, having access to treatment on school sites, right? We know kids are at school most of the time, right? 9 months out of the year, sometimes in the summer. Their teachers and school staff tend to get to know them very well, so they can pick up on things when there are problems. So it's a really good network of support. With schools being closed, we're obviously losing that. I think one thing to really focus on is that this is not a permanent loss, right? Fortunately, kids will eventually go back to school and we will have this safety network again. But I do think that in the meantime, it's something that we're missing out on because, a lot of kids are really struggling right now, and families are struggling. We know that with higher stress, which is in adults often related to financial stress, that this heightened level of stress increases the propensity of violence in the home, and it can also increase just, even that like an abusive response to children in a state of frustration. So those are things that we're all kind of worried about in terms of doctors and psychiatrists. We are worried about those effects and the higher risk of violence. But again, hopefully this doesn't last too much longer, and kids will get back into school, and we won't know what the full effect of this period will be until after, when we're able to look back and study the effects.
As a doctor, you prescribe medicine, and what do you do with a family that may be hesitant or resistant to that child receiving psychotropic medication?
So, absolutely a good question, because, you're right. We, physicians, that's part of our practice, being able to prescribe the indicated medications. And again, that's where our training really becomes important, right? We need to know that we're doing the right thing for this child or for our patient, and really weighing the risks and benefits, and also making sure we have the right diagnosis, right? So all of that is kind of the background work. So when I present the idea of medication to a parent and family, I bring it as a discussion, because I want them to feel that they are completely involved. I want them to know that this is their child, and I want to take care of their child. I want to do what's best for them, and I want them to feel that that is the case, right? I never go into something thinking, this is my recommendation, this either needs to be done or we're not doing the right thing. That's also not true, right? I think with kids especially, it's really important to make sure that we're doing everything we can to help that child, and not putting an overemphasis on just psychotropic medications, right? Because that would be the wrong thing to do. We all, doctors in general, we always joke about magic pills. We don't have the magic pill for anything, right? We always, we want to look at the big picture, and most of the time, being well is a multifactorial process. We talk about circumstances, stress level, exercise, nutrition, and then sometimes medication. I often will give the parent plenty of time to ask questions. Sometimes I say, go home, think about what we talked about today. We'll talk about it in the next appointment. You can bring more questions, and we want to make sure that they feel comfortable and know what's going on.
Okay.
As best to their ability, of course.
Okay. As a psychiatrist here at the Ville, can you share with the audience your primary role, the things that you do here?
Sure. So, I think one of my primary roles is to serve in terms of consultation to the entire treatment team, right? Therapists can come to me and discuss a child or a family that they're working with, and maybe even just start with bouncing some ideas like, what do you think I should be looking out for? Does this sound like something that needs to come to you now? So just kind of discussion about different cases that are here at DeVille. That's one thing. More formally, I work to help with the diagnostic process. When a kid is referred for a psychiatric evaluation, I do it even though they've already had, a full evaluation with our team and our intake specialists. I still get all that history again to make sure that I have a pretty good understanding of the situation. And then, sometimes it'll take a couple visits, but I help with clarifying the diagnosis and then also with providing additional treatment recommendations.
Dr. Martinez, here at DeVille, since the COVID crisis, have you noticed an increase in depression or suicide with our consumers?
So fortunately, suicide, no, right? That's really, I think, an important thing. It is something that we are worried about, right? As a society and in the field of medicine and psychiatry, we're definitely worried about rates of suicide increasing. And really, it is predicted that anxiety and depressive disorders, that all of that is increasing, and that makes sense, right? Because these are disorders that that with stressors, with things that we're experiencing like financial stress, risk of homelessness, job loss, increased stress in the home where parents are trying to navigate really difficult systems with their children, not having the same level of support that we used to have, and that's true for the kids. They're not in school, they don't have that same level of support from school staff, but parents also, and as a family unit, we don't have the same level of support in terms of our social support, right? That can include our social circle, our friends, our families, our church, all of these things that we really need to thrive, right? So these stressors and loss, and then on top of that, now you're hearing about, these statistics in terms of death. So I think a lot of people are also going through a sort of grieving process in being socially distanced. Technically, you can still have some support with things like Zoom, right? And all of the media that we have at our disposal. So with these stressors, kind of bringing it back to the point, was that external stressors do increase the risk of either onset or recurrence or worsening of anxiety and depressive symptoms or episodes. So I have seen, in my own, patient caseload, I have seen an increase in that, and people, or people that were doing fairly well that are decompensating. And so, we're dealing with that appropriately. And some of that is also related to the sense of helplessness or hopelessness. And that also brings up the idea of suicide again, where hopelessness and a sense of loss and despair, that's related to higher risk, it's considered a risk factor for suicide. So definitely things that we need to keep looking out for and really continue to address.
You mentioned Zoom. When the COVID crisis hit, DeVille had to make this quick transition to Zoom. And so how does that work for you as a doctor?
So, I have to start by saying that I definitely felt blessed and fortunate to be able to do my work still. A lot of people were not able to initially work, and that is incredibly scary and tough in terms of the circumstances. But you guys were very quick. DeVille was very quick to make these adjustments, and again, nobody really knew exactly what we were getting into right away, and I certainly was not. I had actually never used Zoom before, so yeah, all of my practice before that had been in person, with very few remote options, and actually we had to get this very quick approval by insurance and the county and all of that to be able to provide services via the remote services like Zoom. I think in the beginning I was just kind of doing my best like everyone else. I think I got the hang of it. I would say I still prefer in-person visits overall. I look forward to being able to do that again, especially for the smaller kids. You know, it really allows for more options in terms of what you can do. But we're hanging in there, and I think thankfully, we have this available now. If I initially was thinking, you know, had this been 20 years ago, we would have been so limited in terms of what we could do, because we didn't have the same level of, you know, media or platforms available to use.
Okay, all right. As a doctor, you know, in the community in which we work, being a psychiatrist, where do you see this going in terms of mental health services, you know, with government cutbacks and funding, managed care, and all of those things? Where do you see this going?
That's a lot of stuff. That's a lot of stuff to really try to deal with. You know, I think all of us doctors are very aware of the managed care system and how that places limits in terms of care, and even specific to mental health services. You know, insurance companies were known to pay much lower rates for things like mental health. It wasn't considered equivalent in terms of health. Fortunately, that has changed in California, where going to your psychiatrist is the same as going to your, you know, primary care doctor. In terms of where it's going, I like to keep an optimistic outlook about the whole situation, really thinking that we're working towards decreasing the stigma, increasing access, and increasing preventive care as opposed to, you know, just crisis interventions and just ER visits. Again, that's kind of like my hopeful perspective. Again, with COVID, we really don't know what the long-term consequences are going to be. I'm sure there will be many in various realms of function, but I think some of that we'll just know with time.
Okay. You mentioned prevention and early intervention. You know, how do you see that working in communities of color?
So actually, this is one of the reasons why I choose to work with, you know, DeVille and with communities of lower socioeconomic status and minority communities, because I think, again, representation matters, right? Being able to see people like you and feel understood and feel a connection, that makes a difference. We know that that actually improves healthcare outcomes, right?
Yes.
So that's still, you know, a big goal in medicine, to really keep shifting and improving the demographic to better suit the needs of our country and our population. So in terms of taking care of, you know, these communities, I think, again, it comes down to education, awareness, the importance of seeking treatment before things get, you know, what we consider out of control, or before things get overwhelming. And this is especially true for young children. We know that kids are resilient. We know that kids are, you know, they're extraordinary in terms of what they can get through and overcome and still go on to live, you know, fruitful, successful lives. But that changes when you are exposed to things over and over, or when situations that could have responded to intervention and support are missed. You know, we know kids that get treatment for ADHD do better. They're less likely to drop out of school, they're less likely to engage in criminal activity or drugs. So these are things that we want to be able to impact. The same for autism. Early intervention can dramatically improve the outcome and improve a child's social skills and abilities, and overall function. So really bringing the focus to the need to address things. And I always like to make the comparison to just general conditions, because I think people understand that a little more easily, right? It's like with high blood pressure. You want to start dealing with that early. You don't want to wait until your cardiovascular system is so damaged, or you've already begun to have effects like stroke, right? You want to try dealing with that earlier, because then you improve the response and you end up with less consequences that are irreversible, basically.
Okay. Listen, I am so grateful that you are here at DeVille, and the difference that you're making. There are a lot of other questions I had today I wanted to ask, but our time is winding down. What would you give as some advice to parents today? I mean, as we close out this interview, in light of all that's going on with COVID, the socio-economic, political, employment kinds of things, what would be some suggestions that you would give to parents?
Yes. Well, thank you for inviting me today. And DeVille is a great organization, and I really feel like my work is helpful here, and I feel good about the work I'm doing. So thank you again.
Yes, thank you.
In terms of what I'd like to say, I actually want to bring it back to a little bit about how to deal with stress right now and how to cope with COVID in general. There's a lot that we can do to kind of minimize the negative feelings, and that is what we basically consider self-care, right? Self-care and really caring for each other within the family unit. We still are recommending social distancing, but that doesn't mean you should be isolated, right? You can still connect, and I very much encourage people to still connect with family and friends. We before this we say limit kids' screen time, and you should still have limits, but it's okay for kids to FaceTime their grandparents and FaceTime their friends. With appropriate supervision, of course, but still connect, right? And then try to make the most of your day, right? One of the things that we know affects people negatively is a loss of structure. So actually, try to establish a regular routine where it feels like you're still getting up in the morning and still getting ready for something, being productive, have your, daily goals, daily plan. Still maintain a sleep schedule. That's critically important. Get enough sleep. When you don't sleep enough, you feel worse, and you're more likely to get sick. Another thing that I always recommend is exercise. I know most gyms are still closed, right, or have limited options, but that doesn't mean you can't exercise. There's so many ways to exercise, especially now with all the media that we have available. There's a lot of free applications that can be used. You can still get outdoors, go for a bike ride or go for a run. Or, again, in the comfort of your own home, you can still, even with a small space, do some basic exercises to get your blood flowing and to have the benefits of exercise. And then lastly, I would say be kind to yourself, right? No one has the perfect answer right now. Nobody has, the perfect setup. No one knows exactly what's going to happen. So allow yourself to accept that. Don't focus on the things that are out of your control, and really just try to do your best in the moment.
Dr. Martinez, thank you for sharing today. I look forward to our next time of coming together and having this chat. The staff at DeVille are just rave about you and who you are as a person and as a doctor. And so thank you for all of what you're doing for DeVille and our consumers and the community.
Thank you. thank you for having me on the show, and really it's a pleasure to be here and to work with DeVille. I love what I do, and this is a great place to do it.